As we now know that hormones play a very crucial role in how the body functions, from metabolism to growth and development, emotions, mood, sexual function, and even sleep, one of the areas that we're going to be focusing on now is the impact that hormones play on higher function. And for this discussion, we're joined once again in studio by Dr. Mark Opperman as we continue our series around hormonal health. So Mark, let's talk about higher function. I mean, it's quite a bold term. I think people aren't all familiar with it. Just explain and unpack for us what higher function is when we're talking on this topic.
Michael, higher function would include things that's done by the brain, like thinking, emotion, how we act on those primitive emotions that we have. So for me, that's what higher thinking and higher function is all about.
Right.
It's how the brain interprets the sensory stimulation and then the emotional responses thereto.
Okay, now we've very briefly touched on the impact of hormones on the brain function. So let's expand now on the discussion around what do hormones actually do that impacts higher function?
So let's just go one step back. As we discussed in previous episodes, we have a myriad of hormones, actually just a little bit more than 50. Now, a hormone is a chemical messenger that's formed in one part of the body and transported via the bloodstream and has an effect on something else. So I think for the majority of people that are watching this program, when they hear hormones, they're thinking women, estrogen, men, testosterone.
Yes.
So let's focus on those two. What we need to understand is that both testosterone and estrogen is in men and women. We have both of those. Testosterone and estrogen are steroid hormones and they are psychoactive,
Right.
which means that they have an effect on the brain. When we look at where we start with testosterone metabolism, it starts in the brain. So the brain is what signals a part in the brain to stimulate our testicles or our ovaries to produce testosterone. So that testosterone is then circulated via the bloodstream back to the brain where it has an effect.
Okay.
So let's stop with testosterone for a moment. Testosterone elevates dopamine levels. So we've all heard about dopamine. Dopamine is a feel-good hormone. Actually, dopamine is a neurotransmitter. So it's also a chemical messenger, but it works between nerve cells. Okay? So one part of the brain communicating with another part of the brain. So testosterone has an effect on dopamine. It elevates dopamine levels. It also has an effect on serotonin. And serotonin, as we know, is associated with depression and anxiety. So those two are responsible for communication between different parts of the nervous system. It helps us with depression, anxiety. That's testosterone.
Right.
So if we go over to estrogen, now we need to remember both men and women have estrogen. It's very interesting that the highest concentration of estrogen receptors in the brain is the part of the brain that's associated with learning and memory.
Okay.
So estrogen helps us to form memories, cognitive function, and we see that in our patients when hormone levels starts declining, that these are some of the first symptoms that they present with.
Can you then draw a link between age-related dementia and the hormonal changes in bodies, or is that sort of very advanced stages where other things have started to come into play? I mean, would that be an indicator early on? I mean,
absolutely,
okay.
Yes.
Okay.
As we've discussed in previous episodes, if we look at women specifically, women who have optimal levels of estrogen in menopause and even post-menopause have a 4 times lower incidence of Alzheimer's disease and dementia. So your hormone levels, which are responsible, as I said, between communication of nerves, repair of nerves. It's also anti-inflammatory in a lot of cases. Testosterone in itself is an antidepressant. So yes, absolutely. Changes in hormone levels can be indications that bigger things are happening, things that the symptoms are not yet clear of.
Right, right. So now let's talk about those symptoms. I mean, what would the symptoms be that you have an hormonal imbalance that is causing some kind of impaired higher function?
So it's interesting that the majority of the patients that present to the practice, if a female, complain about brain fog. So brain fog is something that's difficult to describe. I think the best way to do that is, what's that guy's name again on TV?
Yeah.
I know it. Hold on, I'm going to tell you now. That's brain fog. Now, a lot of the cases, we have patients that, why am I in the kitchen? I
went to pick something up, I don't know what it was.
Or they do something else, and that becomes frustrating for them. So that's brain fog. Women present with that a lot. And then we have changes in memory, where it's more difficult to recall numbers, for instance. When we look at other higher function, and here we go to emotional and mental wellness, irritability, mood swings, depressed mood, and especially anxiety and depression itself is associated with changes in hormone levels. Again, it's got all to do with the communication between different parts of the brain, because hormones affect neurotransmitters. Neurotransmitters affect chemical balance in the brain and in other tissues.
And it's fascinating the interconnectedness of the whole system, because you talk about the impact of depression on hormone levels, yet hormone levels can affect moodiness, depression.
Absolutely.
So you've got this consistent or constant interplay and balancing that's trying to happen. Why is it so difficult for so many people to regulate that balance naturally or normally?
So let's look at environmental factors. We know that we are exposed to so many environmental estrogens, for instance, phytoestrogens, plastic estrogens, etc., etc. We are exposed to heavy metals. That has a role to play because that accumulates in fatty tissue. The brain, 70% fat.
Right.
When we look at our stress levels. So the hormone that's associated with stress, for instance, is cortisol. Cortisol being a hormone that elevates for a short period of time, and then when the danger is over, decreases again.
Yes.
When we are constantly in fear or anxiety or stress, that level stays high, and it leads to downregulation of the other hormones, specifically testosterone and estrogen. So stress leads to that.
Yes.
Immobility, people that don't move. If you just sit, you know what? That's going to have an effect on testosterone. Testosterone being the precursor of estrogen, you're going to have a downregulation in both of them.
Right.
Diet. And here we're looking at the big culprit, sugar. And the other one that comes from sugar, alcohol.
Yes, okay. So now these things are lifestyle factors that can be manipulated, influenced by making better decisions for the most part. Now, in terms of hormonal treatment, therapy, replacement that you guys do, how does that process work in the higher function space where you need to regulate, you want to get things back in balance, you're going to cause a shift across the board if you move one of the dials.
Yes.
So how do you regulate that and find the ideal sweet spot where you really are getting a good impact on higher function?
So Michael, you've referred to something basically that we've discussed in a previous episode, and that's that cake, that prize-winning cake, the recipe for the cake. If I change the quality of an ingredient or the quantity of an ingredient, it changed the outcome of the cake. So what we do in our practice is we establish baseline. So we go and we take blood tests. And our first consultation is based on a very detailed medical history and a detailed understanding of what our patients are presenting with. When they come back, we marry these two. We marry the biochemistry with the symptoms. And then we work out a treatment protocol. And that treatment protocol can include hormone optimization therapy, where we can use testosterone, estrogen, we can use DHEA, we can use vitamin D. Those are all hormones. Bespoke nutritional supplementation or IV nutrients. So we add that in. But the biggest thing that we do with our patients is we let our patients monitor themselves.
Yes.
Remember, we're changing the cake. We need to rewrite the recipe. The only way that we're going to do that is if we keep on baking and tasting the icing and the cake, etc., etc. So it's about communication, about what we are doing, how our patient is experiencing the changes that we are bringing about to find where it works well for them. We can overtreat, we can undertreat. It's communication with the patient. And that is what makes this work so fascinating, so interesting, but also so difficult.
Yeah, absolutely. But I think what's great there is that people are starting to gain a deeper awareness of their own bodies because they've got to focus on it to get the best out of the treatment. Mark, people who want to find out a bit more about the possibility of some treatment from you, or just to find out more about what we've been talking about, how can they get hold of you?
Sister Elise always says, we're on Facebook. I don't know what, but we're on Facebook. The other one is our website, www.tclinic.com, or our phone number in Johannesburg. We also have a branch in Umhlanga, 010-824-1393.
Wonderful. Mark, always good to chat to you, and I'm really enjoying this discovery of hormones and the impact, because it really is so interesting how the entire body is
It's such a fascinating field, and we're learning about it so much every day.
Well, thank you for the efforts that you're making, because I think a lot of people are benefiting from it. So thanks for joining us.